be doing a lot of neck treatments with Profhilo, aren't you, Cheryl?
Yeah, I love Profhilo for the neck. It works so well. And it's very comfortable. But it does give you lots of funny marks to go home with.
They go down very quickly, I find. But yes, you do see these little blurbs, don't we?
Like little mosquito bites.
It's great that the hyaluronic acid just disperses at the
Yeah.
end of the skin.
And that erythema that you see is normal.
Normal, yeah.
Can you take it up and just want to make sure? And you just allow them to dissolve themselves. You don't squash them in.
That's right. I think that's very important to know because everybody assumes that we are massaging and
Sorry, of course.
this isn't a normal filler. It's not a filler.
It's not a filler. It's just two different strengths of hyaluronic acid. Raise your chin up a little bit for me.
I find this works beautifully on the neck, either on its own and then in combination preparation for your
ND.
treatments. Exactly. How does it feel having these done? You've had one half of your face treated.
It feels absolutely fine. You can barely feel it. It's a little bit sometimes where you sort of feel it going in a little bit, but it's only slightly uncomfortable. It doesn't hurt at all.
Yes.
And last time I had it done, the marks were literally, I said to Cheryl, I couldn't believe it, she's got magic fingers. They'd gone by the next day, weirdly, slightly quicker than the face.
And they're going down as we speak already.
There was hardly anything left.
Oh, that's great.
And of course, little scarf anyways, possibly required, but I didn't even have to do that.
Absolutely. Looks great.
Okay, can you start again? Okay, so turn. Go up, not like flat. Sorry, I can't do it with my hands.
How's that?
Everyone should have this.
Oh yeah, no, I think it makes such a big difference to let a little bit.
Well, the concept is, hyaluronic acid under the skin, we lose 1% every year after a certain age, and we accelerate when we're exposed to things like excessive sun and stressors, exactly. It's nice to be able to know that we'll be able to literally put it back.
We're just putting back what was there before. And it's as I say, it's pure hyaluronic acid. It's cross-linked with heat, so it's not going to create any structural differences. It's just for just one more right under.
Think, Fiona.
I had it a month ago, and I was amazed at how quickly the bumps went. Faster even than the face, although that was only a couple of days. So as soon as it's done, from now, they'll just start going down. By the time I get home, in sort of 45 minutes or so, I remember thinking I could barely see them. So that's great when you want to just continue as normal.
Going down very quickly already.
Yeah, you can almost see which is the last one, which is the first one.
Totally.
And you've
That's
got the
great.
treatments for your face. This is the second area now you're having.
That's it. So I had it, my face done a couple of months ago.
How
Two
did you find
lots. it helped enormously. You remember I came in January just like beside myself. Menopause had just literally hit horribly, and my face, I could do nothing. Dry everywhere, so
Dry.
flaky, and just I felt horrendous. I looked horrendous, and having that treatment, weirdly, like literally overnight, all the dry patches, the eczema just completely stopped. It completely cleared up. And I felt it was just fuller, and I just felt so much better myself. I just didn't look so horrendous anymore. So it's a really nice feeling that it seems sort of not expensive and not a huge fuss to go through. Yet it just made such a difference to me.
Certainly, you want to have dry January in many ways, but not that type of dry January.
You're right. And neck-wise, it's just, as I'm getting older, it was starting to look really different from my face. Just like, oh God,
But that's the
this is
thing,
really old.
we do a lot to focus on the face, but then we don't do anything to the neck till it shows up. And I think we should really be thinking about the neck from the beginning.
Always.
Because the neck is actually harder to get it going because we've taken so much longer to actually do something about it.
I should have done something years ago, but
you've
hopefully this will
started
help.
now.
Yes, thank you, Fiona. Thank you, Cheryl.
Thank you.
So I guess that's the bottom line, everybody. Begin anywhere. I think that's very important. Bye.
Thank you. Bye.
Begin anywhere is really important. It's any way you start the patient's journey. That's what it's about. Bye, everyone.